Hello everyone, welcome back for another edition of Teen Yoga. I'm your instructor Mike and I'm happy to have you all with me this evening. What I was thinking about doing for our practice tonight is a spine series. A lot of people, we're talking not just old people, we're talking young people, are going to have back pain at some point in their life. They actually say 4 out of 5 Americans are going to deal with debilitating back pain at some point in their life. So again, 80% of us are going to deal with this. So I think it's a good idea to show you a practice where something that you can do routinely that helps prevent back issues. So let's make sure that we keep up on that, right? Stay ahead of the game on that, because one of the worst things that you can deal with is having to treat back pain, when in reality what you could be doing is this to prevent back pain, right? Simple things like that will make a huge difference for you. But a few things you may need before we officially get this started. A yoga mat obviously is pretty ideal, so if you got one, go ahead and grab one. If you don't, that's fine. Just do this on some carpet if you got some nearby, or just like a rug, whatever works for you. Just something that you have some cushion so you can sit on, you can lay on. Other things you may need, you might want to have like a towel or a blanket, a prop like a pillow or a yoga block. If you got a yoga block, go ahead and grab them. Any kind of prop, whatever you need, go ahead and grab it. And when you're ready, we can go ahead and get this started. So we'll begin in a comfortable position. It could just be laying down on your mat. It could be sitting upright like you're in meditation. So wherever you're most comfortable, go there and then close your eyes. There's nothing really to see at this point, just more to feel and pay attention to. And I want you to focus on your breath and breathe low in your belly, low in your diaphragm. And if you want to double check if you're doing that correctly, place a hand on your stomach below your belly button. You're going to feel the stomach expand when you take an inhale. It contracts when you take an exhale. And this is belly breathing. It's the breathing technique I'm going to recommend because it's going to help slow things down. It's going to slow the heart down, slow the nervous system down. It's going to slow your mind down. And again, what we're doing today, it's more of what's called yin yoga, which is a gentle stretching style of practice that you hold poses for a while. You probably do about 2-3 minutes with each individual pose today. But we're focusing more on the spine. Normally, in a practice like this, we'll do hips and spine. And we'll do a little bit of the hips, but today is primarily going to be focused on the spine, the lower back, the lumbar spine, which virtually most people, when they have back pain, that's where they're going to deal with it. So this is going to be a sequence and a practice that helps prevent that and can help treat it if it is happening. As always, in this practice, if your body is telling you that you have had enough, please listen to it, right? Let experience be your guide. So if your body is saying after a minute in a pose you've had enough, then make your way out. But if you want to hold it the entire time or even a little bit longer, that's up to you. But like I said, my advice is to let experience be your guide, which means let your body tell you what you need to do. When you're ready, go ahead and open your eyes. And we're going to start this off loosening up the hips, but more so the spine. So you go ahead and lay on your back with this. I want you to bring your knees up to the chest, cradle the legs. Just rock up and down on your spine, go side to side. Might even be able to crack your back a little bit here and there. Sometimes you can. Not no big deal though. Just some gentle movement, right? This isn't really a pose or anything. You're just using some rhythm and repetition to wake up the hips and wake up the spine. And we want to make sure that we do this, right? We want to make sure that we have some kind of warm up before we get into any kind of exercise. I know me when I was a kid, when I was a teenager, I used to think, like warming up is for the birds, right? I'm good. I'm ready to move whenever I'm in it. But the reality is, the more you warm up, the less likely you are to injure yourself. It happens, right? We're not invincible. Right, our bodies, we're physical, right? Physical things break down after a while. So again, let's do our best to prevent that. Delay the effects of breaking down and falling apart with age. We're going to do a couple of forward bends. We're going to do the inner thighs to start and round forward. But the first option I'm going to give you here, this is called Butterfly pose. It's where you have the soles of the feet brought together in front of you. You fall in round in the pose as best as you can. Don't worry about getting the head to the feet. It's not the point of this, right? I just want you to be able to bend forward here, get the inner thigh stretch, get the back stretch nice and broad, right? But if you're saying, I actually kind of feel this more like in my knee, or my hip, or the back of my hips, you're feeling something that's too localized. And anything like that is overstretching. I'd recommend doing a dragonfly pose. You spread out the legs, you lean forward, you get your inner thighs, you get your back stretch, right? It's really important to do this. So whichever one works best for you, go ahead and do that. Whatever that is. I don't really know what exactly that's going to be for you, because every day we do this, it's different, and everybody is different. It's just a scientific fact, right? We have similar anatomy, right? Just being human beings, we have similar anatomy, but it's still different. It depends on a lot of things. It depends on our genetics. It depends on our environment. Everything is a factor as to why we're different. But something that's really important to know, when it comes to our literal skeleton, the shapes of our bones are different, right? So some people have certain bone structures that allow them certain movements where others don't have that. And it's not because you're inflexible, it's literally because your skeleton is stopping you from achieving that. And something I try to remind all of my students, like contortionists, for example, they have similar bone structures. They have these really, really crazy back bends. They have very externally rotated hips. They have joint mobility that's out the wazoo, right? Normal people don't have that, which is why normal people can't work for being a contortionist, right? They are gifted a certain set of bones that allows them to do those movements. But not to put down their incredible feats of strength and flexibility, because they work for that, right? They continue to do that to maintain it, but they also have bones that allow them to do this in the first place. So please don't get it twisted where you think, I must be really inflexible because I can't do something, right? It literally could be because of your skeleton stopping you. And I'll teach you what exactly that is, how you can identify if it is your skeleton, or if maybe you are just inflexible. When you're ready, real slow, use your hands, push yourself up. I want you to lean back, and then I want you to lay down. Right, just take your time. Right, in between every pose, we're going to take a break here. So just really try to relax and observe all the differences you made with just that one pose. Hamstrings coming up next, and we're going to do this one at a time to make it a little bit more about the back. So you're going to have one leg extended out, and then you're going to play around with the other leg. I'm going to give you a few choices, but the first one I'm showing right now, this is called half butterfly pose. You have one foot in towards groin, you got one leg out. Every pose we do is going to have one leg out. And you lean forward over it and grab something. It could just be grabbing your knee, shin, ankle, around the foot, toes. You can grab them. If you're, again, really bendy, you probably can. And if you pull back on the toes a little bit, you can get this bonus calf and Achilles tendon stretch, right? This is extra, it's not a requirement, but a lot of people, they're like, I'm already here, I might as well just give it a little bit of pull there, but nothing too much, right? I don't want you to grit your teeth and flex so hard that the veins in your neck and forehead start popping out, right? Because that's not relaxing at all. In fact, you're gonna pull a muscle, you'll probably pass out. So please don't do that. So again, half butterfly with external rotation. That's what this is. But another one, just in case you want to try it out, half frog. You turn the opposite leg with internal rotation. Same deal, lean forward. I personally hate this pose. And it's not because I can't do it. It's because my knee and my hips are screaming at me. Right? I can physically do it, but not without having some kind of extremity bother me. This is localized. This is compression, right? So I'm overstretching, and I'm also feeling bones hit each other. So I know that pose isn't good for me. So I'll do a half butterfly. But plenty of people out there who can do a half frog. In fact, plenty of people, that's their preferred method, where half butterfly really bothers their knee or their hip. Right? It doesn't matter how you do it. What matters is, do you feel the back of this leg, and do you feel your back? And just to talk more about the back, it's going to be more of the side. It depends on which leg you're stretching. But for example, if you're stretching your left leg like I am, lower right side of the back is going to be the target area. Something else you can always throw into it too is rounding into it. Take the opposite arm of the hamstring stretching, really try to round, target those obliques, right? This is a different way to bend your spine. Normally when we bend our spine, it's down the middle. And this is called flexion, by the way, when you bend forward, just directly down the middle. But this is called lateral flexion. You're bending forward, but you're also going to a side. So it's a different way to work your vertebrae in your back, which is why we're doing this, right? We want to make this more about the spine. When you're ready, there's your time. Just real slow, use your hands. Push yourself out. Again, lean back, lay down, take your time. On that, no rush to go anywhere. Just relax a little bit. Try to feel the difference between the two sides, right? We've only stretched the one leg, so I'm sure it feels different. When you're ready, other side. Whatever side you're on, just make sure it is the other one. That's really important to do. You want to stretch both sides. Half butterfly was the first option that I had suggested. Just one leg out with external rotation of the other leg. Half frog was the second one, where you take the opposite leg with internal rotation. Same deal, lean over the extended leg. This is not working for me immediately. I can just feel knee and hip pain, so I don't bother with that at all. Half butterfly is going to be my personal go-to. Might be for you too, but it also might not be. Grab something, knee, shin, ankle, toes. If you can grab them, if not, it's fine. But I want you to feel the back of the leg, right? That's your hamstring. I want you to feel the back, right? Lower side, depending on which leg you're stretching. If it's the right leg, it's lower left side. If it's left leg, it's the lower right side, right? Because of the crossover that's taking place. Broad stretches here. That's what we want to work through. Tension is what it's called, the broad stretching pain. And that's what we can change. That's a sign that you can increase your flexibility when you're going through that broad stretch, which is good. It's good to know, right? If you're doing a pose, you're doing some kind of practice and you can't do it because you're feeling tight, you're feeling inflexible, that can change, right? The more you do it, the more flexible you can become. But when it comes to compression, where two parts of your body or bones run into each other, that's the ultimate range of motion. You physically can't go past that because there's nothing left to stretch through. And this is actually a good example of compression here, using this particular pose. Some people can get their chest and their head down to their knee, right? That's compression. When the two parts of the body run into each other, you can't get past that. Others never get there though. They'll bend forward and at some point say, I don't feel anything stretching, but I feel this pinching pain right here on top of my pelvis, right here in my hips. That's bone on bone. That's your femur, your big leg bone hitting your pelvis. And you can't change that, right? There's nothing left to go through at that point. So when you start hitting those compression points, which could take months and years, at some point you do, that's when you have to start modifying. That's when you have to start getting creative and experimental with your practice. We say, well, what happens if I lean this way? What if I can try to work around that compression so I can find tension again and keep stretching? And it's an endless game, right? It's something you'll be doing forever. As long as you're practicing yoga, as long as you're in physical body, you'll be experimenting with all those different things. When you're ready, there's time. Just real slow. Use your hands. Push yourself out. Lean back. Lay down. Take your time. Just real slow. Short breather here, as always. The next area we're going to work into, it's going to be the IT bands. This is called your iliotibial band, and it runs from the ilium to the tibia. So it's glues to knee on the outside of your leg. So whatever leg you're going to stretch, it's going to be the outside. But if you start feeling knee or hip pain, listen up to the modifications that I suggest, because a lot of these will be able to work around it. But the first one I want to do is called Shoelace Pose. You have one leg tucked under, you have the other leg crossed over. So you're going to do your best here to stack your knees, right? And they don't have to be like perfectly aligned, but we do want to have this kind of crossover here so where they kind of look like they are stacking. But it's the outside of the top leg. So right now, again, just for example, my right leg is on top. It's the outside of my right leg I'm feeling when I bend forward into it. And if you're leaning into it and you're saying, it's my knees now or it's my hips, you could always try untying the shoelace, right? Just open it up a little bit. Or you could just try a different pose. This is called square pose. You take this top leg and instead of crossing it over, you rest that foot on the bottom leg's knee, right on the inside. So it's still top leg, right leg getting this one when you bend in. Either way is fine, right? You can lean in as much as you want to with your square pose, but I just wanted to do the shoelace pose. This is what I want to do today. It's what my body is calling for here, and that's something I recommend everybody do. When you do a practice, just listen to what your body's telling you. If it's saying, hey, this is the way I need to do it, then that's the way it needs to be done. That's fine, right? It's okay to do it that way. In fact, that's the best way to do it, to listen to what your body is telling you. Because a lot of people, they don't do that. Right? A lot of people don't bother listening to their body, and that's when we start hurting. We start having pain and difficulties moving, and it sucks. It sucks to deal with, right? So let's make sure that we prevent that just by maintaining movement. I can't really emphasize that enough. Stop these kind of pains before they start happening. And the best time to do it is when you're young. Honestly, I consider myself lucky for finding yoga when I was 20 years old. I wish I could have found this when I was like 10, or I wish I could have been almost born into it, because there's still 20 years of my life where I was neglecting my body. I was an athlete for the majority of that time. And once I started hitting 20, that's when I started noticing things falling apart. But thankfully, again, I found this, and I've been doing my best ever since to prevent it and treat all those injuries, those previous injuries that I used to have. When you're ready, your time's real slow. Uncross, lean back, lay down. Take your time. Short breather. Other side, when you're ready. Whatever side you're on, just make sure it's the other one. For me, it's my left side now because I start with the right. So I'm doing a shoelace pose where I'm stacking my knees on top of each other. Again, does not have to be perfectly aligned. You'll probably notice that the two sides are different anyway, so don't freak out about that. But you're gonna lean forward here. Outside of your top leg gets this. If it's knee or hip pain, just, try out the modification of untying the shoelace, open it up a little bit, same deal. Or just try a square pose, right? You got the foot resting on the bottom leg's knee. And still again, top leg, getting this one. When you start leaning forward, maybe I'll spread myself out, right? And you lean in. Outside of the leg, still getting the stretch there. But again, shoelace was working totally fine for me, so I'm just gonna stick with it. I also enjoy doing this pose because it's not as deep of a forward bend as the square pose. It's still bending forward, but it's not going as far. Again, it's just a different way to work the back, because that's what we're trying to do here. And like I said, it's important to keep up on. We're going to deal with it at some point. And a lot of people, it flares up on them when they start hitting their teenage years. It could be just because of things like scoliosis, which is just abnormalities in how the spine grows more towards sides, right? Kyphosis, that doesn't really happen too often when you're a kid. Most often that's going to start happening when you're an adult. Kyphosis is the hunchback, right? When you start rounding over. So all of these things are going to help prevent that and help treat things, especially, again, scoliosis. It's really, really common for a lot of people. And I think it's within like, I don't know, like a 4% difference of a curve is what they classify as scoliosis. Most people don't even realize that they have it. And it's not until someone points it out where it starts bothering them. This is a psychological effect where when a doctor says, hey, this should be hurting, it starts hurting, right? That's sort of a psychological, mental effect to it. So sometimes when you don't know, it doesn't hurt you. But if you know what's going on, then you can do your best to treat it. You can do your best to prevent it if it's possibly going to happen to you. When you're ready, there's your time. Just real slow, uncross. Take your time on out here. Lean back, lay down. We got 2 more poses left. We got to do a back bend, and then we got to stretch our quads. But before you know it, we're going to be done with this practice. So our next pose is going to be one of our back bends. It's called the Sphinx Pose. And we've done this one before, where you lay on your stomach and you prop up on your forearms and your elbows, right? This is the pose. It's not really a stretch or anything. You shouldn't feel any broad pains in your back, but you should feel this dull pressure right there in your lower back, in the lumbar spine. That's all it should be. If it's anything sharp, please come down. Right? Any sharp pain, lower down. I mean, do not push through it. It's not therapeutic for you. Dull pressure is, though. And something you can do here to increase this even further, if you feel like you need it. Some people like to lift their feet up off the floor like this. It helps tilt the pelvis and your sacrum to go forward, increase the curve in your back. Might be all right, but it might be too much. Like for me, it's a little too much. I start feeling sharp pains. It's really uncomfortable. But some people could go for more, extending the arms out in front of you. We call this one the seal pose if you're ever doing a yin class like this, but sometimes you'll hear it called upward dog or cobra, depending on the style of yoga you're doing. I'm doing this in a modified way. I have my hands very far out in front of me. And there's a reason for it. My lower back doesn't have a deep bend here. And it's not because I'm inflexible. It's not because I'm not trying hard enough. It's because my skeleton is stopping me. And you might want to try this one out too, right? First, start off with your hands in front of you. But if you work your hands in closer to your hips, and you notice your hips come up off the floor like this, like how you see what's happening right now, you're reaching the full range, right? I'm actually overextending by doing it. I'm putting my spine at risk of too deep of a bend. So I'll slide my hands out and find out where my hips touch the floor, and that's my full bend, right? And everybody has a different bend. Some people like me don't have much. This is maybe like 50 to 60 degrees of a curve. But some people can go up to 90. So imagine going up to like that perfect straight angle, or even further, right? Contortionists, we talk about that too. Some of them can go well past 90, more towards like 110, 115 degrees. Not something you can do by stretching. That is something you are born with, right? You develop that differently as you aged. If you're ready, though, we'll say it's time. It's real slow, lowering down, laying on your stomach. It's going to feel really nice at some point to do a gentle forward bend. Usually child's pose is going to be the go-to for this one. You can always do other things too. Laying on your back and cradling the legs is the same thing as a child's pose, but you could always do like a down dog. Okay. Actually, that feels pretty nice. Stretch my calves a little bit. Got one more pose left to do. We have to stretch our quads, and we're going to do another back bend. Listen to your knees when you do this, right? If you're having inside or outside the knee pain, it's just really, really uncomfortable, listen up to the modifications I'm going to give you. But I'm going to give you two choices. But the first one, this is going to be the more knee-friendly option. This is called the bow pose. You lay on your stomach, you grab onto your feet, and you pull it, right? And the more you pull here, the more you get. So some muscular effort's going to be required. And the reason why it's knee-friendly is because you can control how much you're pulling, right? If it's not enough, keep pulling. Too much, let it go, right? You're right out of the pose if you have to be. But then your other option, this is the more deeper version, so it depends on again, how mobile you are, how flexible you are. It's called saddle pose. So you can sit on your feet like I am, or you could always sit on the floor. Knees will tell you, though I have to have my heels underneath. And you start leaning back, right? Hands are first, elbows are going to be next, right? Laying on your back is going to be the full range of motion. So whatever works for you, because everybody's going to feel it differently. But it's upper thighs that you're going to feel stretching. You're also going to feel some compression, right? You're going to feel that dull pressure once more in your lower back. That is to be expected, so please be mindful of that. Wow, I definitely needed this one today. And I think about it, I haven't done a full saddle pose like this in quite a while. A lot of times when I teach it, I usually don't lay down, but since I'm doing this virtually, I can show you what it looks like to lay all the way on your back here. So whatever works for you. And it's always listening to the knees. And remember to breathe, too. Definitely remember to breathe. When you're ready, there's your time. There are two ways to get out of this one. It's either coming up to a child's pose or letting the legs out. I usually come up. If you're in a bow pose, though, you just let it go. And real slow, same deal, gentle forward bend. Child's pose is usually the go-to out of this one. It's the path of least resistance. We're at the end of our practice. If you're ready for Shavasana, for corpse pose, you can do a few things. You can always just lay down on your mat. You can sit upright like you're in meditation. Wherever you're most comfortable, go there and close your eyes. There's nothing to see at this point, just more to feel and pay attention to. Focus on your breath. Breathe low in your belly, low in your diaphragm. Turn your senses, your awareness within, and observe all that work you've done with your practice. Give your body a compare and contrast. How different do you feel right now as opposed to when you first started? no formal ending to our practice. Keep your eyes closed as long as you like. That's officially all that I have for you. I want to thank you all for watching and sharing your practice with me. It's been my pleasure.
Namaste.